Afternoon, everyone. I'm Madeline Milka, President and CEO of APAICS, the Asian Pacific American Institute for Congressional Studies, and welcome to this APAICS in Conversation with Sheri Daniels. We are so excited to have Dr. Daniels join us today. She has been a participant in our previous summits, specifically the health summit that we had earlier in March. And if you want to catch her on that panel, you can still go onto the APAICS website to check out that panel discussion. And so we are very honored to have her participate with us. She has been leading Papa Ola Lokahi, the Native Hawaiian Health Board, since 2016. This is the organization charged by the United States Congress with administrative oversight of the Native Hawaiian Healthcare Improvement Act. In this role, she leads efforts to improve the overall health and well-being of Native Hawaiians and their families through strategic partnerships, programs, and public policy. Born, raised, and currently residing in Maui, she has over 2 decades of experience in social service programs, along with years of supervisory experience, including both government and nonprofit management. It is through these capacities that Dr. Daniels has worked closely with Hawaii's unique and diverse population to overcome inequities. Sheri is actively involved in various community and civic organizations locally, nationally, and internationally. She was recently added to the International Indigenous Council for Healing Our Spirit Worldwide in 2018. In 2019, Dr. Daniels was added to both the Advisory Council on Minority Health and the Department of Health's Tobacco Prevention and Control Advisory Board. She is one of the co-leads for the Native Hawaiian and Pacific Islander Hawaii COVID-19 response, recovery, resilience team that involves over 30 organizations throughout Hawaii that is focused on addressing the needs and advocating for these communities. We are delighted to have her join us today. And for our moderator, we have Kim Ku'ulei-Birne, who is the communications lead at Papa Ola Lokahi. Thank you for joining us, Kim.
Thank you so much, Madeline and Jennifer, and to everybody at APAICS, the Asian Pacific American Congressional Institute for Studies. I'm familiarizing myself with the organization, and mahalo for all the good work and for the internships that we've been able to partner on. That's a lot of information about my boss, Dr. Sheri Daniels. So now you all have the scoops on what her credentials are, but I wonder if we could get a little more personal insight into how you got to where you are in this leadership position at Papa Ola Lokahi.
Well, thank you, Kim. And for those of you, Velina mai kako, it's really great to join everyone on this conversation this afternoon. If you're in the East Coast, this morning in the West Coast, and here at 8 a.m. here in Hawaii. But Velina mai kako. As Kim said, I think you guys all heard a very large mouthful of who I am professionally and I guess all the alphabet soup stuff after your name. But I guess a little bit about myself. I'm, as Madeline pointed out, I'm born and raised here on Maui. So I grew up here in Hawaii. I think one of the strong pieces that I bring to the table is my commitment to not only the work for Native Hawaiians, but really for our neighbor island communities. I think oftentimes it's so easy to focus in on some of our urban cores, such as Oahu, but we know that our rural communities on Oahu, but also our neighbor islands are really important. Have 4 kids. My keiki are all products or involved in the Kula Kaiapuni program, which is Hawaiian language immersion. And so I'm very fortunate to have that ability to watch the next generation be immersed and have that ability to have ike in our kupuna and our kupuna knowledge and the things that I think really make us who we are as Native Hawaiians. Beyond that, I think for me, the ability to have space, have voice, have meaningful engagement and intention as a Native Hawaiian wahine is really important. But it also plays into how we engage with not only our communities, but also our partners and our allies here in Hawaii, but across the country and across the world. I think it's really important for us to recognize Native Hawaiians exist in many pockets and many communities all around all around the world. But, Kim, before we get started, I want to kind of turn the camera a little bit on you. And if you can introduce yourself, because I think it's important for our audience to see that, really great moderators and panelists, they have to have a little groove going on and a dance. And so I want people to know who you are as well.
Oh, okay. Well, let's groove then. Kim Ku'ule Bernie. I've been at Papa Ola Lokahi a long time, more than 16 years, and it might even be more. That's the last time I counted. I'm the communications officer at Papa Ola Lokahi. I came aboard to take on certain projects and special activities. And with some experience in radio and communications, I kind of fell into a communications role, and then have tried to strengthen it here ever since. We've been on Facebook since 2009. We've kind of been an early adapter when it comes to the social media, but I was raised in a lot of different places. I don't often tell this story. I was raised in a lot of different places. Both my parents were born and raised on Oahu in Honolulu. They come from two completely different social and economic circles, and they probably never would have met here in the islands, but they met in Monterey, California, and what they had in common is that they were both homesick for the islands. So, I've got some diverse background, as I said, two completely different circles intersect. And my brother and I are truly Hapa in the truest sense there. So, and my father was in the military. I've lived in a lot of different places. I've seen a lot of different things. And again, we were always homesick for the island. So I grew up during the Vietnam War. I was a young child during the Vietnam War. We came back here every summer of my life because my father was always overseas out of every year for many years. And it's always been home. It's where all my grandparents are buried, and it's home. It always was. And we are all back here because we were part of the diaspora, and now we're all back home. And I have my own family here.
Well, and Kim, I think that's what I want the audience to recognize is that, diaspora here in the islands, it doesn't matter. There's always that need to be home. And like you, I'm, I guess, considered a little N, meaning that on paper, I'm 50% Hawaiian, which allows me to have access to things like Hawaiian homelands, and which I am a homesteader and a beneficiary up in Keokea farm lots here on Maui. But similar like you, Kim, I think when I think like the true sense of Hapa, I am really half. My mom was pure Hawaiian. Her ohana is from the east side of Maui. My grandfather was from Koali in Hana, and my grandmother was from Kapuna here in Waihe'e on Maui. And my dad actually was here during the Vietnam War and was from Waynesville, North Carolina. And, I think for those of you who can imagine what it was like for my mom in the late 60s to be married to a non-Hawaiian, was very interesting in itself. But I think growing up in this atmosphere of, it was during that kind of almost a resurgence of who we were as Hawaiians in our identity, it wasn't really popular to be Hawaiian. And so I think for us, my siblings and I, we had that mixed look. So we didn't look like our cousins who were darker than us. And I think, so I think that plays a role in how it shapes you as a leader in our community, because even today, Hawaiians come in all shapes, sizes, forms, colors, beliefs, ideas, all of those things. But I think at the core of it, we all respect and understand the values that our culture brings. So Okay, so we got our introductions out of the way, and I know you have tons of questions for me.
I
So
do have a few questions, and I want to stay on the positive because I'm going to ask you what some of the challenges were in getting to this leadership position. But who were your mentors? How, who were the people that really supported your path, either knowingly or unknowingly, just were real supportive forces for you?
well, I definitely think, and I get asked that a lot, and it always racks my brain. But I got to go back to this philosophy of reason, season, lifetime. That I think throughout my life, I've had people who've come in for very short touch points to those that have really made lasting impact. And I think the lasting impact people was both my mom and my grandmother. I think that strong wahine, that strong female in my life was really important because I think they also balanced that with a lot of love and a lot of nurturing. And so really taking from that, because when you lead, it's not about you leading and having the credit, but it's you helping those that you're leading find their potential and to so that when you kind of wane off into the sunset, or that they're able to continue with the things that you've helped enrich and instill in them. It's kind of like, I think, what I got from my mom and my grandma a lot, just that hard nurturing. And I know that's an oxymoron, but that's what it is. I think
that might be your values. Maybe that's where your values were established from your mother and grandmother.
So I definitely think that. I think in terms of other influences, I do know that I've had really great supervisors in different positions that I've worked along the way that I think pushed me out of the comfort zone. And at the time, it didn't, I didn't recognize that as that. It was more like, oh my God, what are they doing? Like, I don't want to do that. This isn't what I went to school for. But I think in retrospect, it was really expanding my understanding of what I was capable of, and really being there to almost not even open doors, but basically force me to knock on those doors. And so I have some of those in my life. And I think the other big influence, or the other reason, was early on in my career, I worked in the substance abuse area, and with those that were incarcerated and dealing with mental health and addiction and just other, social challenges. And I think there was learning opportunities for me along the way. One that really helped me solidify about why I do what I do, and that, it keeps you focused and grounded. I think oftentimes as a leader, and as you move through your professional ladder, up the ladder or across your ladder, you forget why you started doing this work in the first place. And then you forget that your voice is not the only voice, and that you're really there as the conduit in most cases. And so I think a lot of the people I worked with, a lot of the clients that I had, opportunity to support and engage with, helped me really recognize that I cannot forget really who I am and where I come from, and that there's some power in that alone, right? And that you hold that. And so I think it's that need to be constantly reminded. And even now, there's many situations that people I come into contact with reminds me of that. I think we get so caught up in power and what we're doing and who we're impressing, and at the end of the day, that is all irrelevant. It is about the work that you do and the intentions behind that work that you do. So I think for me, that's been always really important.
I think it's an important way to think about that mentorship and the support you've gotten, because at the same time, you pretty much just identified what some of your challenges are, right? You said politics, the power, the control, the less than confidence, at least until you get pushed through the door, right? Awesome. So what's the biggest project that Papa Ola Lokahi is working on right now? I think I know this, but there's a lot of stuff we're doing right now.
I think there's a lot. I think I'm going to go top two, because I think one of the challenges is, everything is a priority. Everything is a project that, is important to us. But I think maybe the question is, what is the most pressing issue that seems to occupy our time? And I think for everybody listening in, it's this pandemic. And not just, COVID cases in particular, but all the residual, all the threads that come out of this pandemic. I think
it's impacting us in
right.
so many ways.
In so many ways. I think, we, as Madeline mentioned, we oversee, or we're part of the Native Hawaiian Pacific Islander Hawaii COVID team, which is 60 plus organizations and growing. But I think, that's the immediate right in front of us, the how do we support choices people make? How do we keep our community healthy? How do we thrive? How do we continue to be, a community of Native Hawaiians? I think that's our biggest checkbox right now, is how do we do that in a way that, and recognizing we're not going to make everybody happy, but how do we find that space of intersection, that I call it the soft, gooey, gray matter, because that's important. And when this wanes and we continue to do our projects and do things, what is going to be left in terms of what does our community remember us for? What do our partners and our allies recognize about us? So I think that's really important as our team, because the boots on the ground, the community voices, and all those that touch it. I think the other large piece that POL is working on is our ARPA dollars. So the American Recovery Plan was funded, and we, through the Native Hawaiian Healthcare Improvement Act, was awarded $20 million. And we call it our Namakawai project. And for those of you, quick lesson in kind of visual, but our lo'ikalo, our system of food, of sustainability, is nourished by our waterways. And as Native Hawaiians, the lo'ikalo is a food source, is a lifeline. And so the namakawai are one of those feeders of that water source from the source. And so that really is what we see as this project is. We are able to get these resources and push it into our networks, into our lo'ikalos, to help nourish them. We recognize that that is where the work is happening. And we are really the conduit. We are really that makawai for them. And so, that's one of our big ones, where we're taking these dollars and we're using it into communities through our Native Hawaiian healthcare systems, but also through community partners in Hawaii. So we have 15 of them doing all kinds of amazing work around COVID work, from vaccinations to outreach to you name it, we've got it. And we're going to be rolling out who they are and what they're doing in the next few months.
Real soon, right? Thank you so much. And the thing about these top two projects is they're both related to the pandemic. And because it's a pandemic, these aren't things we can just put aside and say, oh, we have a new priority now. I mean, this is a pandemic. And so we can't let go of it. We're in it as long as it's around, right?
Right.
So I forgot that this is a half-hour program, not a full hour program. So I want to ask some general questions about leadership. Like, what kind of leadership do you think is important? What does the Native Hawaiian community need to really focus on a thriving Lahui, or a thriving Hawaiian nation, a thriving Hawaiian people? What is the leadership in general that is required of us?
Oh, geez, that's a half an hour discussion in itself, but let me just bullet point this. I think Hawaiian leaders need to be true to themselves and true to their community. I think there is something to be said about integrity and intention. And it's okay if you make a mistake. It's okay if, it didn't go the way you planned it. But I think having very clear and I'm going to say this, clean intentions is really important, because when you start putting in other benefits that really don't serve our communities, you've done a disservice. And not to say you're going to put us on pedestals. We're human. We're going to make bad choices, bad decisions. But I think it goes back to what was our intention and what do you do after that? And how do you stay in your truth and own it? And I think that's really a hard place to be. And so I think there's a constant need to check yourself as a Native Hawaiian leader, because I mean, really, I think that's really important. And I think the ability to understand the multifaceted beliefs and understandings and passions and the emotion that is often driven in the issues related to our community. I mean, from land to resource management, to traditional practice, to everything, education, health, all of that. I think a good leader recognizes that there is more than one school of thinking, but how do we encourage that learning and that critical thinking for our Native Hawaiians? And so it has to start with you, right? And so I think that's also another important key, and the need for constant lifelong learning. However that fits into your world, I think the fact that, I continually learn and I want to, I think that's a really great sign of a good leader. I think we need more Native Hawaiian leaders, not only in Hawaii, but across the country and in the world, because we need to start kind of putting on the table or putting to task, where are these other voices that need to be there? How do we create meaningful engagement, not only for our Hawaiians, but all communities, right? So I think that's important.
Absolutely. And you're really excellent at identifying in everybody what their interests are, where their passions lie, where their strengths are, and really lifting that up. And there are so many bosses out there who want everybody to fit into the mold of some mold that, they inherited or they brought in. And so you're really excellent at identifying those strengths and lifting them. What is your vision for Hawaiian health? Let's say 5-10 years down the line. It may or may not include you. It may or may not include Papa Ola Lokahi, but what is your vision of a thriving Lahui?
So I often, when I first started this job, I really saw that when we look at policy and we look at engagement in community, that it really is flipping it, right? To have communities be the drivers, that communities should be lifting up to what their needs are, which we know they recognize based on their community, that's what we need to work on. And I've kind of moved to this place of, I think it has to be a come to the middle sort of arrangement. Because I think when you expect one or either one side to come to the other, you expect that there's already trust and rapport and that already invested in it, and it might not be. Where if the sides come to the middle, that there is there's investment on both ends to demonstrate the building of trust. And I think that, action says a lot. And so I'm going to kind of adjust my thinking a little bit, and my philosophy of that's where we need to move is I'd like to see Hawaiian health, but not just Hawaiian health, Hawaiian initiatives, Hawaiian engagement really start coming to the middle, really that we don't have to draw the line in the sand and say, you got to come to me. No, you know what, if we're going to be partners, if we're going to be trusted allies, if we're going to work together, we got to come to the middle. So I think that's important. I think how we recognize what health is so large and so encompassing. It just isn't about physical health anymore. It's about how we educate our children. It's having access to education. It's the land, it's resource management of where we live, who we are as Hawaiians or as any culture, right? Where do we see ourselves and our connection to that culture and that place, especially for—
It's our relationships, right? It's our holistic view of our relationships, and not just to one another,
but to the greater, to everything, right? To every facet of somebody's life, but also to the And I want to say the intangible pieces. I think one of the things we recognize as a community is this ability to connect to even intangible concepts and beliefs. Nothing right or wrong about that, but that's important for us. It's that gut feeling. And for many people, it's really hard. So I think health, we're there, we talk about holistic health, we have for years, but it's not just talking, it's actually practicing and behaving in that manner of holistic health. And so I think that's going to be
a beautiful vision, a beautiful view where we're all in harmony, right? With the intangibles, right? The spiritual, our environment, the physical, our relationships with one another. That's a beautiful what. And I think some of the hows that you described just now kind of answer this next question. So this last question is Asian Americans, Native Hawaiians, Pacific Islanders, how are we, if you can answer for all, how are we rising to the challenges presented us today?
So, I think it would be easy for me to just kind of like broad brush it. But I think I want to answer specifically for Native Hawaiians. And I think it does roll into the other communities as well. But I think COVID we recognize it's highlighted a lot of inequities. I think it's highlighted inequities in our community, in the partners we have working with our communities, the resource holders, all of that. So we recognize that. It's highlighted it. I think we become much more clearer on what we expect now from those resource holders, right? And that it's and doing it in a way that's not combative or rebellious, I guess, but really more factual of this is the way we engage. In order for us to be at this space, it's not about tokenizing us. It's not that you need a box to check that now I meet this Native Hawaiian criteria for you, but what is the value that I bring to this seat, to this table? Where's the other people that look and sound like me, right? And so I think we're starting to recognize that we need to use our voice to not only uplift ourselves, but our communities and those of similar communities. So I think that's really the work that's being done, is people are finding voice and using it to ask the question and no longer acquiesce to what we get and be thankful for what we get, but to say, no, how do we make this a larger inclusion of people so that we can have conversations and that my participation and my engagement with this is meaningful. And meaningful doesn't always have to mean a positive outcome, Meaningful means that we could disagree. We could be on totally different sides. Meaningful means that we're able to put it out there, to put it, mark it in the book, to say that we brought it up to our attention. We're raising the awareness. So I think when I say meaningful, I want to be very clear that I don't mean that we're all going to be running off, chasing the rainbows together.
Right.
And that's okay.
Not successful, but meaningful.
Correct.
Yeah.
And it might be successful to me, maybe not to you, but yeah.
Right. Thank you so much, Sheri, for your passion, for your insight. That was Dr. Sheri Daniels, Executive Director of Papa Ola Lokahi, the Native Hawaiian Health Organization. Thank you to APAICS for hosting Papa Ola Lokahi today. I'm Kim Ku'ule-Burney with Papa Ola Lokahi, and we're grateful for the opportunity to share with your audience and for all that you do for our community across all of our Asian and Pacific Islanders and Native Hawaiian communities. Back to you, Madeline and Jennifer. Mahalo nui. Thank you.
Thank you so much to Kim and to Sheri for joining us today. We really appreciated having this talk story and having this opportunity to hear from both of you about all the wonderful work that you're doing to support the Native Hawaiian community. We appreciate all of your leadership and look forward to continuing our partnership so that we can uplift all of our communities. Thank you to the APAICS audience for joining us today. Excited to continue to see you through the end of this year. Continue to look up all of our programming at apaics.org and any of our social media channels. Look forward to seeing you the next time. Take care, everyone.